this time, Democrats and Republicans can and should work together on policy solutions with the shared concern about our healthcare system. We need to figure out the issues and principles on which we agree, especially in the individual and small group market. For example, most everybody agrees in this country that we need better coverage at a lower cost. But to do that will take a solid understanding of how insurance markets work by pooling risk and incentivizing healthy people to take part. You can't get something for nothing. Insurance products don't simply come in an a la carte form where you can just check off what you want. And so there's a number of shared goals that Democrats believe we can work with Republicans on. We can work on reducing premiums. We can work on reducing deductibles and out-of-pocket costs. We can create conditions that favor competition among health care plans in every sector of the market. We can bring down prescription drug prices and many more. Now, this sounds simple, but all of these issues are highly technical. Addressing them will require consulting regularly and upfront with experts who can guide us to policies that will create more stability in the marketplace without eliminating vital consumer protections. And it's going to take thoughtful bipartisan discussion that might take longer than some people want. But that's how you get good legislation that actually works when you're dealing with complex issues. For this effort to succeed, and this goes back to what the president said about the healthcare system exploding. For this effort to succeed, the administration needs to overtly avoid any further actions, whether intentional or not, that would sabotage the ACA. First of all, we need to stop this loose talk of the system imploding or exploding. It creates uncertainty in the markets, even though it's patently untrue. Even Standard & Poor's said that the exchanges are stable, and it's easy enough to disprove thanks to continued high enrollment in the exchanges. Earlier this month, in fact, the Congressional Budget Office confirmed that the market for individuals to buy health insurance policies would, quote, probably be stable in most areas under current law. The next thing that has to happen is the Republicans need to drop their lawsuit seeking to stop the cost-sharing reductions that ease the burden of deductibles for lower-income Americans. Pending an appeal, these cost-sharing payments continue. But if they were to end, most insurers would abandon the individual market. The president has in his hands, solely in his hands, the choice of whether the premiums people pay will be 25 to 35% higher. And he can order this lawsuit withdrawn right now, and he can avoid that from happening. Republicans have promised repeatedly as part of their claims that they're going to make deductibles more affordable. Abandoning cost-sharing payments would have just the opposite effect. We also need, frankly, to get some clarity about the vaguely worded executive order on implementing the ACA that the president signed on his first night in office. It left insurers bewildered and uncertain about how to make long-term plans for pricing and other decisions. In fact, a lot of analysts compared it to a bomb thrown into the insurance markets. As time ticks down this spring for insurers to determine their participation in the marketplace, further steps along those lines could threaten the stability of the markets and provoke a crisis. And the administration should promise not to take steps that would depress participation in the next enrollment season for the ACA. This was a mystery to me why they did this. Don't halt advertising for healthcare.gov as it was done in late January. Don't shorten the open enrollment period as the president has suggested, because it would deter just the people we want from enrolling, the younger, healthier people, and it would diminish their access to quality, affordable coverage. After 7 years of noisy partisan wrangling, I can confidently stand here today and say there is a path going forward to strengthen our health care system. There are reasonable, effective solutions that can secure bipartisan support, and help us fulfill the duties that we as elected officials have to our constituents and to all Americans. And I think, based on the achievement of 21st Century Cures last year, that bipartisanship really is still possible in our government. And I think that's what the American public wants. Our constituents have been so persuasive and persistent because they want to see us work together to truly make their insurance more affordable and to make health care more available to them. And that's why we should seize this moment in a bipartisan way and do what's best.